Now, there is a resurgence of Mpox virus, also known as the monkeypox. Several cases have been reported across many countries and regions, notably the East, the Central, the West, and now even the South of Africa. Now, DRC Congo, the Democratic Republic of Congo, has been the epicenter of this new resurgence. Now, the biggest question we have today is, can Africa effectively manage the Mpox resurgence? I'm Michael Odhiambo, and welcome to Africa News Debate. So this is Africa News Debate that comes to you live on Facebook, Twitter, also now known as X, and also on YouTube. Now, the WHO, the World Health Organization, declared the Mpox virus a global emergency or a public emergency, and even the recent information that came from them is that they're not terming this another COVID. Now, the Democratic Republic of Congo has seen quite a resurgence, with the WHO now saying that this new strain is lethal and very contagious and is quite dangerous. Now, so far we have at least 18,000 cases that have been reported among, and at least 500 people have been confirmed dead so far. With out of these reported cases, we have 70% of them being children. Now, we have also countries that borders Congo, like Kenya. We have also Uganda, we have Burundi, and even some countries like Cameroon, the Central Africa, have also reported some cases. Notable countries also include Sweden, that reported their first case last week. We also have the Pakistan and the Philippines, and even now the US and the South Africa reporting some of these cases. Now, let's take a look at one of this story about the WHO declaring this a global emergency. Take a look.
The World Health Organization has declared the Mpox outbreak in Congo and elsewhere in Africa to be a global emergency. The virus is usually mild but can cause rashes and lesions on the face and hands that can spread to other parts of the body, in some cases can be fatal.
We need to understand the transmission patterns. We need to understand the populations that are risked, and it's dynamic. There are multiple outbreaks that are happening. There are changes in terms of what we're seeing in the epidemiology itself. To understand that better will help us to use the limited numbers of vaccines that we have in a targeted and a most appropriate way. So I want to stress that one point. And secondly, to request, if there are countries that have vaccines to donate, to come forward and to work with us.
Since January 2023, the DRC has reported more than 22,000 suspect Mpox cases and more than 1,200 deaths.
And a person is considered infectious from the onset of symptoms until the skin lesions have crusted and the crusts have fallen off and there's a new layer of skin. Transmission occurs mainly by large respiratory droplets or by direct contact with body fluids, skin lesions, or contaminated clothing or bedding.
There are two types of Mpox, Clade 1 and Clade 2. Clade 1 usually causes a higher percentage of people with Mpox to get severely sick compared to Clade 2. Clade 1 is endemic in DRC.
Welcome back to Africa News. Our main question today is, can Africa effectively manage the Mpox resurgence? Now, even the question that we are bringing across also involve various government facilities where they can, whether they can easily manage this outbreak. We conducted a survey on our YouTube community whereby we asked the question, can Africa and even their facilities curb the spread of this new strain? Now, majority of people said no. That is 58% of those who voted say that Africa is not ready to contain this strain or the spread of this new virus, while 42% also said yes, that Africa somehow can manage to contain the spread of this virus. Now, we also looked at some of the comments that they put across there. We have one by the name Knowledge Economy, who said readiness should include funds. How did it come about? Tackling it from the source. How is it transmitted? And this also includes cure. And then another comment was from Jungle Traveler, who said, probably not. Africa is not ready to contain this virus. And sampling also the last comment we have here is from the Larry Marx, who said it's not ready at all. Still lacking in medical technology. Now, we can see that some of the comments there probably giving their views on how many, whether Africa is actually ready to tackle this virus. Now with we have our panelists who will help us dissect this whole topic and question of the resurgence of this new virus. Now you can join us on the YouTube and also Africa News Facebook page and also on Twitter, and you can also put down your comments there. Now our panel, we have the incident manager of Mpox at the World WHO Regional Office for Africa, Dr. Samuel Boland. Hello and welcome to our program.
Thank you very much for having me, Michael.
Now, back there you saw some of the survey we conducted about whether Africa was actually ready to tackle this new strain. What do you say about this new virus, this survey, sorry? Is it depicting the reality?
You know, it's such a good question, and I think that the various different answers to that question, you saw that it lent one way, but it was really split, I think is a real testament to how complicated and difficult it can be to make sure that we are delivering and making sure that we have the preparations that we need. A huge amount of work is ongoing and has been ongoing since the beginning of the global outbreak that began in 2022. But we would not be here today if there weren't gaps in that preparedness. So our job as the World Health Organization, in collaboration with key partners, including Africa CDC, other UN agencies, NGOs, and so forth, is to be working to identify those gaps in that preparedness and that capacity, and to use those gaps to deliver and develop very clear plans that we can then work with countries to fill those gaps and make sure that we are able to plug those holes and make sure that we are able to respond effectively. So really, I think it's a fair question to ask, but I think the key takeaway that we need to have is that there's an incredible amount of work that has been going on over many years to get us to where we are now. And we need to remember and keep that at the core of our thinking when we see all of the effective work that's going on to contain this outbreak in many, many places. But those key gaps are there, and we are here to support member states to be sure that we can work to fill them.
The WHO, how do you assess the current readiness of Africa health systems to manage a large-scale Mpox outbreak?
There's a short answer to that question, and then there's a longer one, and I'll try and thread the needle between the two of them. The general state of readiness, and we do these very, very complex, detailed analysis about exactly this question to assess the capacity of each member state to be ready for being sure that they can effectively and comprehensively respond to these outbreaks as they occur. And absolutely, we identify gaps. Now, these are scores that go up to 100, and so we would never expect that any country was sitting there with full capacity, with no problems at all, right up until that 100% mark. But with those analyses, we're able to deliver and develop these really detailed plans. And particularly after the declaration by Director General Tedros of the Public Health Emergency of International Concern, we're taking those plans and we're looking at those readiness assessments and the gaps that they identify in a number of different countries across a number of different sectors of their response. And we're developing very, very clear and significant plans for making sure that that capacity can be delivered where it's needed most over the coming even few days, let alone weeks, months, and hopefully as well translate some of that into more longer term health system strengthening over the years to come.
Yes, thank you. I've heard you highlighting about some of the gaps and the challenges. What are some of the challenges you are currently facing at the WHO in terms of assessing the information, in terms of even dealing with this outbreak?
There are so many challenges, and we all know this listening in on this call, that the situation and the capacity of health systems and the public health system in so much of the African continent can be, in especially rural areas, can be very stretched. And so There are a number of different challenges, which include being able to access very hard to reach areas. There are some places in the east of Congo, for example, which are very difficult to access because of insecurity. There are challenges related to making sure that decentralized laboratories have the necessary equipment and the necessary supplies that they need to be rapidly testing. And of course, we also have the key gaps related to things like case management and countries being able to deliver effective treatment of sick individuals in particularly those rural places. But even moving through those one by one, we can look at each of those different challenges as also a space in which we can do what we can and work with member states, but also work with partners to intervene. So with regards to accessing conflict-affected areas in the Democratic Republic of the Congo, we're able to decentralize and to work with local communities and community groups to be sure that we're able to access vulnerable populations in those places. With regards to laboratories and the fact that many of them are missing some of those essential supplies to do the adequate testing, we're delivering testing equipment and we're delivering the consumables that you use when you do these tests to be sure that they have what they need. And across the sort of band of all of these challenges, that then directly feeds in to guide the response that we bring forward with partners in partnership in the service of the member states who we have a mandate to support as they build up their capacity to deal with this problem.
Yes, thank you for that response there. And one of the things that you have to agree with me is that actually DRC is facing quite a resurgence in terms of the conflict that is going on, especially in the east and somehow southern parts of the country with in relation with the M23 rebels. And this somehow you can also look at it in terms of hampering, in terms of data access, in terms of even equipment distribution, and even some of the medicine, or let's say the practitioner even moving to those given areas. So how is WHO getting all this data, or how do you maneuver around with all these resurgency and violence that is going on in the DRC?
It's such a good question. And, you know, I think that there are a couple of key points to make in response to what is not only a problem for the east of DRC, but is a problem in many of the places across the continent where we as an agency support our member states to enhance their capacity to deal with these kinds of problems. Whenever there is an area that is affected by something like insecurity, we try and we work through partners, especially also through the cluster coordination system with local ministries, and in places where it might not be possible for even local officials to visit, with civil society organizations and with community groups, to be sure that across the full terrain of where an outbreak is occurring, we're able to have at least some amount of access. A lot of the interventions that we work on also may be things that can be done from a little bit of a distance. One of the best interventions that we can bring forward across the board for something like Mpox or any other particular infectious disease outbreak would be to focus on extremely robust risk communication and community engagement. And that means we can use things like the radio to be able to access people that would maybe otherwise be hard to reach by people on foot. But we have already begun the process of activating a huge cadre of people already in place across the Democratic Republic of the Congo and also in some other Mpox affected areas who are already there on the ground in a position to respond and to support the Mpox response, even in these very difficult and hard to reach areas. That all being said, the data issue is a real one. And so what we actually do is we work backwards. When we see that there is a place where we think, or what we are told is that there are no cases, that is exactly where we make sure that we need to go in order to do that active surveillance and that active case search to be sure that we can identify these outbreaks where they are occurring. So we're guided by the data, but we're also guided by the places where we don't have that data, and we know we don't have that data, to be sure that we can do the investigations, the research, and the interventions to make sure that we're identifying all cases of this particular disease as it spreads through these communities and as we work to contain it.
Yes, thank you for that report, Dr. Samuel. Now, Dr. Samuel is now the the incident manager of Mpox at the WHO regional office for Africa, based in Kinshasa. Now, if you're joining us right now, you can join the conversation on Africa News Facebook. We also have X, formerly Twitter, and also on YouTube. You can join us and even leave your comment there, so that you can be up to date and we can even know what we might even pass across some questions that you might push to us. And now let's look at some of the issues that are even arising with this new virus. We have the countries like DRC that are neighboring the Democratic Republic of Congo. Now, Uganda recently issued some restrictions in terms of the movements within their borders to try to contain the movement or the contamination and the spread of this virus into their land. Let's take a look at this story that we prepared for you. Take a look.
To prevent Mpox from entering the country, Uganda has intensified surveillance in its border areas with the Democratic Republic of Congo, which is a hotspot for the virus. Currently, Uganda has no active cases of Mpox, according to the country's Ministry of Health.
We have already intensified our risk communication for prevention. We have also ensured that our laboratory systems are triggered to ensure that they are quick to pick any suspected cases.
The 2 imported cases in late July have been treated and resolved without complications. Up to now, the ministry has designated more than 20 districts along its borders with the DRC as high-risk areas for Mpox transmission.
The known leader as far as responding to re-emerging and emerging epidemic diseases. We've demonstrated so during Ebola outbreaks and also during Marburg outbreaks. So the Mpox finds a very resilient system that will be able to prevent its transmission internally.
Uganda's health authorities also rolled out a nationwide training program for health workers to help them better detect and isolate suspected cases.
Now, earlier on, we were supposed to be joined by Dr. Bamidele MUTIU, who has some technical issues, and we are sorry to let you know that he won't be joining us. But we are trying to, we'll get back to him maybe later on. But on his behalf, we also have Dr. Beth Siwahai, who is an expert. Sorry for that. One of our experts might join us very soon. But now back to you, Dr. Samuel. Now, how is WHO working with African government, leave alone even we also have the institutions and facilities that are across many African countries, like now Uganda, we have Cameroon, we also have the likes of Burundi that are seeing quite a number of resurgence. How is WHO working with African government to even ensure that some of these resources, such as vaccines and medical supplies, are available in these Mpox hit regions?
Yeah, it's another great question. And I think a really good example of that, just concretely for a moment, is to bring up exactly this question of these kinds of cross-border movements. So my office is based in Brazzaville, which is the regional office for Africa, but I myself am currently in Kinshasa to have very clear and transparent conversations, not just with our own country office, which is based here in Kinshasa, and we have some sub-offices across the country, but also through that country office to be sure that we're having discussions with the Ministry of Health and with national health institutes within this region. Now, that kind of engagement is our mandate as WHO, to work with and support member states and to support governments in the decisions that they make related to ensuring that they can provide access to health for their populations. The case in Uganda, I think, is a really good one from this story that just came. The enhanced surveillance, and I want to make it very clear that what is being discussed with Uganda is making sure that there's enhanced surveillance in the bordering regions, but not controls around the border. The World Health Organization does not advise member states to put up any kind of restrictions related to traveling, merely that we have effective surveillance and we're looking to find cases in areas where we might think that there might be movement across those borders. And so with those kinds of pieces of advice, we can work with governments to make sure that they're working according to best practice, and that they can take the best science that we have, and they can take the recommendations that we have, and we can make sure that those make them into national plans, that they make them into national budgets, and that we're able to work with the government in that way, in support of the government, and in doing so build capacity within the government as well, to be sure that we're able to make sure that we have a tailored response that is data-driven and that has the capacity, both technically and financially, to be sure that it's able to save lives, which ultimately is really what we are here to do.
Well, thank you for that. Now, if you remember during COVID time, during the pandemic, we had one of our biggest challenges, even in terms of media fraternity, even you, the WHO. There was this issue of misconception and misinformation that was quite something that we had to deal with, even as practitioners. So right now we have the resurgence of this Mpox virus in many countries. And now if you look at how this information is being relayed, the epicenter is being the DRC. Now, if you go online and you have to see some of the comments that are being, not even comment, but post, some, like one of our commentators here said, lab virus. This was from Blue Rika, who commented on this, saying live virus. So how is this true? Or can you maybe give us, talk about this?
So Mpox itself is what we call a zoonotic virus. So it exists in animal populations, for example, in small mammals. And those mammals, they enter our homes and they present an opportunity for that virus to spread from those animals to people. And once people are affected, it's possible to spread the virus from one person to another. The broader question of this sort of what we call the infodemic is a real, genuine challenge for us. We do everything that we can, and we have teams of real excellent anthropologists and social scientists and communicators to try as best as we can to reach people. And I think, of course, it's a very difficult situation as public health practitioners and as doctors, where we really are here to save lives, when it can be very difficult to reach people when there's kinds of misinformation and disinformation, such as the comment that we just saw. At the end of the day, we need to be sure that we are advancing effective risk communication and community engagement. And both pieces of that term, this is what we call a pillar of the response: risk communication and community engagement. The second half of that, the community engagement, I think is really fundamental. All too often, I think that something that we struggle with is this idea that people have that effective risk communication and community engagement is simply the conveyance of messages, the sort of delivery of information. But real robust risk communication and community engagement includes working directly with and for civil society organizations and local groups that may be better able than us, for example, to be able to tailor messaging in a way that's going to be received, heard, understood, and trusted by the people that make up their communities. So we work really, really hard to make sure that we have that kind of engagement, so that we can be sure that we can bring messages to people in a way that they're going to be understood, that they're going to be trusted. At the end of the day, this particular piece of information that was just given is false, but we also understand that there's a lot of conspirational thinking, and false or not, it certainly limits our ability to do the work that we need to do. What we really, really, really want to convey is that this is a virus which can be very dangerous for the people that are affected. And so it's important to know the signs and symptoms of the virus. And if you develop the signs and symptoms of the virus, then it's important to seek care. And in seeking care, we can be sure that those people can survive and can be healthy and can return to a normal life very, very quickly.
Yes, thank you for that. As we know, information is power, and this is how the WHO tries to engage with the communities, both locally and also internationally, to fight misinformation. Now, with us now, we are joined by Dr. Betha Sewahai, who is an expert in infectious disease. Hello and welcome, Dr. Betha, to African News Debate.
Thank you so much for having me.
Yeah. Happy to meet you too. So you can also meet. We have with us also Dr. Samuel, who is managing Mpox director of WHO in African region based in Kinshasa. So earlier on, before you came in, I was asking about misinformation about this whole scenario of Mpox virus, whereby some have termed it a lab virus. What's your say on this about all this information about the origin and of this Mpox virus?
So it is not a lab virus. It wasn't generated in the lab. Mpox has been around for several decades. So I think that with the right messaging and explanation, we should be able to dispel that notion. As a matter of fact, it was during the time of smallpox vaccination back in the 70s when they found a young girl with a disease that looked exactly like smallpox. But then when they tested, it wasn't smallpox. It was at that time called monkeypox. And so it looks exactly like smallpox, but it's not smallpox. And that girl was living in a village somewhere. And so I say with confidence that Mpox is not a lab virus. So it's important to make that distinction.
Quite informative there. Now, maybe Dr. Beda, you mentioned about smallpox when you were answering this question. How is the relationship between what's the relationship between smallpox and Mpox, maybe to our viewers?
So they look very, very similar clinically with the appearance of the skin lesions, to the extent that when it was found, I believe in early 1970s, at that time, there was the WHO move to eradicate smallpox. They actually thought they had seen a case of actual smallpox, but it wasn't. It was monkeypox. So they're very related.
Yes, hello. It seems we've not been able to communicate back to Dr. Beth. I think she's gone offline. So back to you, Dr. Samuel. We've had quite a number of in Africa. We've seen quite a number of resurgences of various diseases in various in given years over time. How is this difference this time around? Recently, we saw the recent update from WHO was saying this is not another COVID. Is this a case whereby we can say should we be worried about anything, or is the WHO trying to tell us that things are okay, that we shouldn't be worried at all?
The WHO has declared the Mpox outbreak a public health emergency of international concern. And so absolutely, it's a disease and it is an infection that we need to pay very, very close attention to, and that we need to be very, very clear that we understand where it is spreading and that people understand how to protect themselves. Some of those particular pieces of guidance about how to protect yourselves and the kind of care that you can get if you do develop symptoms and what you can do to prevent that from being spread to another person, those are things which we really have very, very good guidance on and are things that we would love to be able to communicate to everyone. So what I would like to sort of recharacterize the question, if I may, which is to say that it's absolutely a concern, but because it's a concern, what we need to do is to translate that concern into knowledge, not just amongst individual people, but also amongst decision makers and health authorities, to be sure that they're able to deliver an effective response to this problem. We're confident that we're able to do that, and the declaration of a public health emergency of international concern means that we can draw in additional resources and international coordination in support of member states and with partners to effectively respond. So we're here to do that. That is our job. It is our bread and butter. But absolutely, people in affected areas need to be aware of this particular virus. They need to know the symptoms and they need to know what they can do to protect themselves. That would be very, very critical to be sure that we're able to ensure that people's lives can be saved.
Now, we've also seen that the number of vaccines that are out there already at the moment the numbers are quite worrying. They're not, we can't say they are enough to help for everyone there, but maybe for even a number of people. But then take us through about the availability of the vaccines. And we also heard that the DRC is supposed to receive vaccines by next week, if I'm right.
Yeah, it's a really fantastic question. And of course, people are so interested in trying to figure out all of the tools at our disposal to respond to this particular problem. So the availability of vaccination across the African continent has been, it has not been there up until now. And a lot of that barrier has actually been a regulatory one. The different licensing authorities that license these vaccines, they have been approved in places like the US and within Europe, but there is not what we call an emergency use listing, which would allow those vaccines to go quickly through the safe, effective, and efficient process of the kinds of approvals that they would need to begin delivering to many countries in the world. That procedure, that EUL, emergency use listing procedure, has been initiated by the World Health Organization, and over the next approximately 2 months will be happening at a very significant speed to be sure that the outcome of that EUL procedure means that we can work with governments. I want to say very clearly, though, that in the meantime, we have already been working very closely with governments at the national level to have very, very clear discussions and guide member states and guide decision makers to figure out how to overcome these regulatory hurdles. And DRC is a perfect example of that. So DRC will be receiving their first doses of vaccination in just the next couple of weeks. And the key thing to remember is that it's not vaccines on the tarmac that we need. It's vaccines in arms of the key populations that need them, and of course, those that want them. And so we are already working very, very hard with member states and with partners and with especially key partners like Gavi and UNICEF when it comes to vaccination, to develop national vaccination planning so that as soon as those vaccines arrive on the ground, we're able to get them out to the people that need them as quickly as possible. So it's been a long time coming, but the vaccines are on their way. And we're working very, very hard with countries to be sure that they are able to receive those vaccines and make them part of their response. The final quick point I would really like to reinforce is that vaccination is one tool among many in the public health toolkit. So even in the absence of vaccination, there's a huge amount that we can do. The best medicine is prevention. And the best way to ensure prevention is to build knowledge and to build understanding about making sure that you know the signs and symptoms and you know how to prevent the spread from one person to another. It does not require vaccination to make sure that that transmission does not happen. It simply means that people need to adhere to public health and social measures, like if they're sick themselves, to avoid coming into physical contact with other individuals, for example. And through these kinds of interventions, we can be sure that we can bring down the number of cases that are affecting vulnerable populations and be sure that we're able to provide help to those that do become sick.
Yes, thank you for that information there. And earlier on, we had lost Dr. Betha, and I believe she's now back to us. Hello, Betha, if you can hear me.
Yes, I can. Thank you.
Yes, before your communications were not working before. So I'd ask this question to Dr. Samuel about the vaccines availability. As an expert, how effective are these vaccines we have? How effective are these vaccines in controlling or being spread of this Mpox virus?
I think the vaccines are very effective.
Yes, but if you look at in terms of efficacy, talk about the efficacy, talks about the strength, the duration in which someone can be protected. How effective are these vaccines?
They worked very well in the United States. I don't have the numbers to share with you, but they were effective in curbing the recent global outbreak that occurred in the US.
Okay, thank you very much. Dr. Samuel, you talked about the vaccines that we are yet to receive in the DRC. Now, earlier on, when we saw about what we saw about the COVID-19 pandemic and during the vaccine distribution, we saw some countries holding some of these vaccines, and yet struggling countries or struggling economies in Africa were trying to get some of these vaccines. Maybe some of them got them through donations. How are you ensuring as WHO that there is equity distribution of vaccines in African countries?
It's such a good question, and it's one that we work hard on really day in, day out. And I think the best example of that I can give is that we have an entire team, not just at the African region, but also at the headquarters, whose really their job is access to what we call countermeasures. Now that goes beyond just vaccines. That looks at things like therapeutics and other key materials that are required to effectively respond to a particular problem like this. And the mandate and the remit of that team is very much about trying to figure out how to harmonize the different public health needs that we see and be sure that we can tailor the delivery of those vaccines to the places where they're needed most. That's a big part of the reason that vaccines are already on their way to the Democratic Republic of the Congo, the hardest hit area, and that we will be tailoring that vaccination plan to make sure that it can be targeted and reach the people that need it the most. All in, putting all of that together, we will definitely need to work hard around the world and across Africa to continue that conversation around enhancing access to these countermeasures. There are big structural issues that often mean that that it can be very difficult to make sure that this key question of equity can be delivered in Africa, but we advocate for it. It is our job to advocate and to work with governments and to work with international partners to do that. And we work very, very hard to build up that capacity and make sure that we can deliver those countermeasures to those who need them.
Thank you very much, Dr. Samuel, for that. Now, back to you, Dr. Beth. We've quite seen research being done here and there. And one of the elements that are very important in terms of understanding and controlling a pandemic or a virus outbreak is research and data management. So far, if I may ask, what are the challenges that experts like you are facing in terms of understanding this new current outbreak of Mpox virus?
Actually, we're not facing a lot of issues because this has been around for a while. As you know, there are two clades of the Mpox. There's clade 1 and clade 2. The one that caused the outbreak globally was the second clade. This clade is a bit more vicious. It makes people more sick. And so since it's been around for several decades, I think experts pretty much have it under control.
Yes, and of course, we also had the WHO saying that, not just WHO, but even health expert saying that it's quite dangerous, it's contagious, and actually very lethal. So how is it, the second strain, how is it different from the first strain, if maybe you can make our viewers understand?
Okay, so the strain that is circulating now, when we say it's a bit more virulent, it makes people sick faster. And the people tend to be in bed. So like the one that caused the outbreak in 2022, the second clade, people can be walking around smiling with you, maybe not overly ill, but they have the Mpox, and they may just have a little rash somewhere on their body without being extremely ill. And so because of that, it also tends to spread faster because you're not aware of who has it. But this one that's circulating tends to make people a bit more sick. You can recognize when somebody is ill because they may have a fever, they have the rash. And so in a way, it's a positive because then you can get to know who is ill and who can potentially pass the disease. So it just has to do basically with the severity of illness.
Yes, you talked about the ways in which this can be contacted from one person to the other. Now, what are the similarities? What similarities do we have between the second strain and COVID-19 pandemic? When you look at COVID-19 pandemic, we had it was quite airborne, And what will you say are the similarities between the second strain, which is quite lethal, and COVID-19? Is it also airborne, or is it also through contact? Or what are the similarities are here, or even the differences, if you may, Dr.
Right. So COVID-19 was a lot airborne. It wasn't by contact, while Mpox is very, very much contact involved. So, for example, if you look at the 2022 global outbreak, it had a lot to do with men who have sex with men, because there was a lot of contact involved. And so it spread to involve many, many countries. In this case, it's not so much that demographic, but it's basically a contact phenomenon.
Thank you very much, Dr. Beta. Now back to you, Dr. Samuel. Maybe how have you been impacted in terms of on the continent, because you are the one who's responsible for WHO in Africa, and in terms of the ongoing vaccination and also the campaign in terms of healthcare? How are you impacting the public health facilities? How are you collaborating with them in terms of ensuring that there's also proper information or proper ways in which they can help contain the virus in case of a larger outbreak at WHO?
Such a good question, and I'm really glad that you asked. Our job, our mandate, is to support ministries of health and member states to have the technical guidance that they need to make the right decisions, including at the health facility and public health facility levels. So for anyone that's on this call that's listening that happens to be a doctor, a public health doctor, someone that is out in the community providing services to those in their community that is at risk of an Mpox outbreak, if you happen to be in one of those areas that's affected, I would really encourage you to be in touch with your local public health authority or be in touch with your national or subnational World Health Organization office. We have a wealth of resources, and our job is to be here to help provide that kind of guidance, as well as training and interventions, to be sure that we can build that capacity within the hospital and also within communities.
Yeah, maybe now to summarize all this debate, and maybe back to you, Dr. Samuel, as a parting shot, where do you think we are heading to in terms of preparations, in terms of what's coming next? Should we be worried? What can you advise the public?
The nature of an outbreak can mean that it can be very difficult to know exactly where it might spread or where it might go. What I can say is coming is a significantly ramped up response by the national communities, the international health community, and the civil society and community groups that we all work with together to be able to respond to this kind of crisis. We should expect, as we build up these capacities and we enhance surveillance, that we will find cases in places where we did not know that were being previously affected. But we need to see those new cases as an example of the success of that surveillance system and all of the work that's going on to be sure that we can find cases where they're occurring and be sure that we can deliver the services and the needs to communities that they need to be able to save lives.
Thank you very much, Dr. Samuel. Now back to you, Dr. Betha. As an expert, what should we do or not do in terms of helping curb the spread of this virus? And you take a look also in Africa, we have quite a lot of misinformation and even information not reaching the right audience. But now, if on this platform, what should we do as the public in terms of helping restrain the spread of this virus?
Thank you for your question. So I think we should learn as much about it. We should stop misinformation and educate other people at every opportunity we can. And I also think that as a general public, this might be a wonderful opportunity to try and deal with this Mpox maybe once and for all, now that it's received this much global attention, given that it's been in the DRC for several years.
Thank you very much for your input there. a lady and a gentleman. So thank you for that. Was Dr. Samuel from the WHO Africa, and also we had also Dr. Betha, who is an expert in terms of infectious diseases. We appreciate you taking time with us, and this marks the end of our conversation today here on Africa News Debate on this resurgence of the Mpox virus. Now you can follow us more and get more information on Africa News from our website, and also you can join in through the YouTube and also on Twitter, that is now X, and also on Facebook. You can find us there and you can comment and follow up for more interactions. And this marks the end, and you can still also like and share this video on various platforms. Thank you and see you. Thank you.
Thank you.